You know, when a woman is diagnosed with breast cancer, there are so many things that starts going through her mind regarding life, her family, about surgery. What kind of surgery is going to be involved? Reconstructive surgery, is that an option? Well, we have brought in a couple of physicians here, well known along the Gulf Coast for being not only a surgeon, but a great plastic surgeon, General Surgeon Dr. Paul Mace, and our plastic surgeon here, Dr. Michael Diaz. Good to have you on the show this morning.
Thank you. Good to be here.
Let's talk about that for just a little bit. A woman is diagnosed with cancer. She's been to her oncologist or whatever. There's just different options that has to start looking at, and things that you know, when they get with you as the surgeon first to find out what their options are.
Correct. And sometimes they have come in primarily because they felt a lump in the breast, and we'll do a biopsy to diagnose the cancer. Sometimes they've already had a biopsy and they come in with the diagnosis. There are a lot of different treatment options that are available, so part of my job is to help educate them into the different modalities that are available and try to tailor that to both the type of cancer they have, their body habitus, what's going to benefit them the most from an oncologic standpoint, and also from a cosmetic standpoint. In the old days of general surgery, we had to do very disfiguring mastectomies. That was the only treatment modality we had available.
The radical mastectomy.
The radical mastectomies, those were just very disfiguring operations. Over the last 30 to 40 years, we have evolved in our approach where cosmetic aftermath is also very important to us. Our reconstructive techniques have evolved significantly. Now, sort of the state of the art for us is what we call a nipple-sparing mastectomy, where we go in with a relatively small incision, preserve as much of the skin envelope and nipple and areola that we can, take out the breast tissue underneath, and do some type of a reconstruction. We will either tailor that to an implant-based reconstruction or using the patient's own body tissues, the tummy tuck flap, to do that. Our goal, first of all, is to treat the cancer in the best way to ensure that we get a cancer-free result and ultimate survival of the patient. But then secondarily, we want to achieve a good cosmetic result so as that patient carries on through the rest of her life, she feels good about herself and how she looks.
And that's one of the big things too. And you hit the nail on the head, because you know, a woman, that's something that they feel like makes them, you know, a woman. That honestly, that the breasts don't make you a woman. I mean, that's how I always felt. It's what's inside of you that makes you a woman. But they want that, the look, the cosmetic look. And there are, Dr. Diaz, a lot of different options now that are available to them.
You're absolutely right, Jim. When a patient hears the words, "You have breast cancer," number one, they're thinking about the cancer like he was talking about, but also losing their femininity. And in the past, the reconstruction options were suboptimal. And the patient would wake up the next morning and they were disfigured. They were upset about the diagnosis of cancer, but they lost their femininity. We have progressed a lot recently, and especially with us attacking breast cancer as a team approach, we're starting on the front end, and we're guiding the patients all the way through their diagnosis and their treatment to give them what is best for them. And now we have a new option that's available, that they also get a tummy tuck. We can offer a tummy tuck.
Oh, I bet the women would love that. I
Absolutely.
mean, here, I get reconstruction, the tummy tuck at the same time.
Absolutely. And it is state of the art. It is, we're the only ones here in Mississippi who offer this operation. The patients no longer have to leave the area to get the best treatment options available that the country offers.
And in the past, they've had to do that.
They have.
They've had to do that, and that's great, because as you said, you two have teamed up here locally.
And Dr. Mace is a fabulous surgeon. He offers nipple sparing, skin sparing, which a lot of surgeons out there will not provide. Then we work together from the reconstructive process to offer implant or using your own tissue tummy tuck flap, which is the best available. 1998, Congress actually did something very good. They actually passed a bill, amazingly. But
we're not going to get into politics here.
but they passed a bill that said all women have the right, after they had a diagnosis of cancer, to all options of reconstruction. We offer all options of reconstruction, all of them. And the patients are covered by this law for their insurance companies to cover these types of procedures. It really is comforting to that patient to know once they have that diagnosis that we are going to walk them through the entire process from A to Z. And when you get a year down the road and you pull up the before and after pictures, and we can now show the after pictures that are actually better than when the patient started. They are cured from their cancer, they've had their mastectomies, and their reconstruction looks better than what they started with. It's truly a rewarding event.
Now, if someone has had breast cancer surgery, but they didn't opt at that time, I mean, it's been a while that they've had it, a couple of years, 2-3 years, or even longer, can they still opt to come back 3-4 years later and get reconstruction?
Most definitely. Yeah, we offer immediate and
Right.
we offer delayed reconstruction.
Because I know someone that had breast cancer surgery, and the surgeon, it was out of state here, but surgeon walked in, did the simple mastectomy. He walked out, plastic surgeon walked in, tissue implant, bam, and just went from there. So it's like immediately afterwards.
Correct. Yes, so patients who have had mastectomies in the past, reconstruction wasn't offered to them, absolutely they can come in and we can take over and we can provide them with that reconstruction as a delayed treatment modality.
And again, insurance would pay for that.
And if the patient had a reconstruction that did not work out well or did not give a good cosmetic outcome, there's still the option for us to come back and do the flap surgery to
You're
revise
reading my
that.
mind. That was my next question. What if they didn't like what they had done years ago?
We're also doing this for patients that have BRCA gene mutations, which means they have a high risk of hereditary breast cancer. Those patients have a 70% risk of breast cancer during the course of their lives. So we're also doing preemptive mastectomies and reconstruction to prevent them developing breast cancer if they're high risk.
I think Angelina Jolie,
Correct.
she was
That
one
is
that had
correct.
that. She,
That is correct.
Before she got it, she went ahead and had a double mastectomy.
Correct.
And of course, you would have to go to your regular physician or oncologist to be tested to see if you carry that gene.
Well, we do that in the office
Oh,
as
do you?
well.
Okay.
Yes.
Okay, that's awesome. That's awesome. Well, I appreciate you gentlemen coming, and especially about the new tummy tuck flap. As you said, another option for the ladies to, when you have some reconstruction done, if you have to make those choices. You can go to the website at Garden Park, find out more about these wonderful gentlemen, Dr. Paul Mace, Dr. Michael Diaz, here locally on the Mississippi Gulf Coast, making things a lot easier for them. Thank you so much again for being here this morning and here during Breast Cancer Awareness Month for this great educational thing for all the ladies out there and gentlemen. Good thing to keep in mind.